Begin with standard hand hygiene. The next step in the donning order is the gown to protect our clothing and body. Put on the gown to fully cover your torso to your knees and arms to your wrists, and tie securely behind your back. The second step is to don the N95 Respirator. Secure the straps around your head, with the lower strap at the neck and the upper strap around the crown of your head. Remember, there are 2 sizes of N95 available at Park, so choose the mask size you were fit tested for. You are not adequately protected if you use a mask that you were not fit tested for. Fit the flexible band around the bridge of your nose, pinch snug to face and below your chin. To check the fit of your respirator, deeply inhale and exhale, ensuring there is a secure seal around your mouth and nose. The next step is to don eye protection. You may wear a face shield, shown here, with headband, or plastic goggles with side eye protection. Eyeglasses alone are not considered eye protection. Secure in place and adjust for comfort and fit. Perform hand hygiene, as your hands were contaminated when touching your face and hair while donning mask and face shields. With clean hands, choose the right fit gloves and put them on your hands, being careful to cover the wrist of the isolation gown. You are now ready to provide patient care.
After performing patient care, the gown front and gloves are contaminated. While inside the patient's room, grasp the gown in front and pull away from your body so that the ties break. Touch the outside of the gown only with gloved hands. While removing the gown, roll it inside out and away from your body, bending forward. While removing the gown, peel off your gloves at the same time, creating a glove-gown ball. Only touch the inside of the gloves and gown with your bare hands. Place the gown and gloves into a white bagged waistband. Perform hand hygiene and exit the patient's room. Don new gloves. Remove your face shield. The outside of your face shield is contaminated, so remove your face shield by touching the band of the face shield located behind your head. Remove procedural mask by grabbing loops behind your ears and pulling away from face. Avoid touching your face. Discard procedural mask. Now remove your gloves and perform hand hygiene. If reusable goggles are used, remove them immediately upon exiting the patient's room and store them for future use. The workflow should be: apply clean gloves, remove a sanitizing wipe from the container, and then remove and clean your goggles. The front of the N95 is contaminated, so avoid touching. Remove the N95 by pulling the bottom strap over your head. Do the same with the top strap and remove without touching the front. Store the N95 in the designated area labeled for your reuse. After removing all PPE, perform hand hygiene with soap and water or alcohol-based hand sanitizer. Please pay special attention to the following addendums that are for North Mississippi Health Services processes. It is permissible to use goggles with a disposable face shield. If you choose to do so, be sure to use Oxivir wipes to sanitize the reusable goggles. N95 masks, covered by an additional procedural mask, are used for cohort units and for aerosolizing procedures. This includes trach care and intubations. This is being done to conserve our supply of N95 masks. Procedural masks are for use with isolation patients and suspected COVID-19 patients. If your unit has this type of reusable face shield protection, please do not discard. This equipment will be cleaned with Oxivir for repeated use. This is the preferred method. Again, it is not a disposable piece of equipment. Thank you for watching this educational video. These interim guidelines are to be used for patients on cohorting units for COVID-19 and aerosol-producing procedures.